Hello, I am Dr. Sanchan, oncologist. I am here with you again to share some tips regarding the coronavirus infection. Today my topic is how will you manage the cancer patients in this coronavirus infection. So being an oncologist, I have some responsibility to my cancer patients. So today I will discuss how you will get benefit treatment. If you like my videos, please see up to the end of the video so that you get some necessary useful tips. What is the immunocompromised state? In cancer patient, the immune system is really very weakened. So in that cases, they may get infection from any other bacteria virus like coronavirus, and they can be deeply infected, and the mortality rate will be high in this type of patients. So we need to take care of this. The CDC recommends that how can you protect yourself? CDC recommend that you can use mask, avoid the gatherings, you can avoid the handshake, avoid the touching of your nose, mouth in your mask, or just blindly wash your hand regularly, at least for the flu vaccine, and stay home as much as possible. Next question is whether you should get the treatment or not. You should call the concerned hospital and get the prior appointment and the specific time, so that you cannot be mixed up with the other patient in a long queue. You can avoid that. If you are in a clinical trial, you can ask your clinical coordinator or the clinical staff or the clinical research team, and they have some specific protocol for you, and just follow them directly. Another question is, what if you have a chemo port insertion for the chemotherapy? What will it do? Now it has been recommended by CDC that you can avoid this flushing of the chemo port even up to 12 weeks. So you can wait up to 12 weeks before flushing of the next chemo port. Another advice for the doctors who are treating the patients is that you can use the oral medication instead of IV or subcutaneous injection, or rather oral and subcutaneous injection rather the IV injection, and you should also consider the home delivery of the drugs. You can use GCSF prophylactically along with the chemotherapy to reduce the admission in the hospital. Some patients may ask that whether I should get the valet parking or the rental cab while go to the hospital. Now the recommendation is you can definitely use your valet parking or rental cab, but use the sterilium or the alcohol hand rub with you and rub with the steering wheel and the door where you are touching. That you should clean before get in and get out of the car. For radiotherapy patients who are getting radiotherapy, there are some recommendations also. Now those who are getting radiotherapy priority based. Those who are having the very high rapidly proliferating tumor like head and neck cancers and other cancers, they will be treated in priority. Those who have the emergency tumor compression of the spinal cord that impending to their paralysis or paraplegia, they are those patients who are actually having the external beam radiotherapy and the brachytherapy together in form of treatment, like in CSR we treat. They are the priority based. There has been data that you can omit the low risk breast cancer, the adjuvant radiotherapy, for meanwhile while this prevailing color. Now what will be the status in case of surgical patients? Now it is recommended that only emergency surgery is allowed. To postpone the elective surgery that are low risk and patients are literally stable, clinically stable, they don't have any life-threatening condition. In that surgical cases, you can delay up. So friends, hope you like my video. It is very short video, but there is some that contains very necessary and useful information for you. If you think that you have any questions to ask me, please ask me in this comment section below, and please like and share the videos with others and let the others know about this topic.